Hello, muscle whisperers. Today we're focusing on something that shows up on your table all the time, and that's shoulder dysfunction. Whether it's impingement, frozen shoulder, or a rotator cuff strain, the one thing they all have in common is this soft tissue movement. So let's talk through techniques to bring healing and mobility back to the tissues that support the shoulder. Depending on what muscles I want to release, you can place your client sideline with a bolster at their knee and a pillow to support the head and spine, keeping both hip and spine in a neutral position. When supine, you would place the bolster at the knee and prone at the ankle. The shoulder is the most mobile joint in the body, but the mobility makes it very vulnerable. We're working with a complex network of muscles, tendons, and fascia. Some of the key muscles to focus on in the rotator cuff is supraspinatus, infraspinatus, teres minor, subscapularis, and the deltoid. So anterior, middle, and posterior deltoid. We will also focus on the pectoral muscles, so major and minor, biceps, upper traps, rhomboids, and levator scapula. So let's get into it. I'm going to show you how I work with the soft tissues to restore function and reduce pain. Starting with cross fiber frictioning on the rotator cuff, I use my thumb or fingertips just below the acromion to target supraspinatus. So I work very muscle specific. And infraspinatus. I use short strokes across the fiber direction, helping to break down adhesions and increase the blood flow. I also do deep stripping along infraspinatus and teres minor with the client's arm relaxed or internally rotated. You can use your forearm or thumb to strip from the lateral border of the scapula toward the humerus. Always follow with flushing strokes. Place the client supine. Locate the space beneath the clavicle. Sink in slowly with flat fingers. You're aiming under the pec major to access pec minor, a major contributor to the shoulder rounding and impingement. Also the biceps. With the forearm flexed, use a thumb, glide over the bicipital groove. This helps relieve bicep tendonitis that is very common in athletes and also people with postural issues. You can also do scapular mobilization and stretch with the client sideline or prone. Cup under the scapula and gently lift, glide, and rotate. This helps to unlock that fascia restriction and restores that scapulothoracic rhythm. These techniques are especially helpful for conditions like shoulder impingement, frozen shoulder, so that's adhesive capsulitis, rotator cuff tears or strains, thoracic outlet syndrome, or any postural dysfunction from people that work at a desk. So we're just training them to rebalance. Here's what I want you to remember. Pain, don't just chase the pain, work the entire shoulder complex. Always check how the scapula moves before and after your session. Use your hands with intention and follow up your manual work with movement cues, breath work, or strengthening to reinforce that release. The shoulder tells a story, which is tension, guarding, and maybe even emotional holding. Your job as the therapist is to listen, release, and support recovery through touch.